Hello and welcome to the topic Allergy Testing and Immunotherapy in the module Immunology. In this module, we will be covering the indications and limitations of skin prick testing and in vitro test for allergen-specific IgE, therapeutic scope of allergen immunotherapy, indications and contraindications of allergen immunotherapy, mechanisms of action of anti-allergic drugs and immunotherapy, and lastly, principles and limitations of allergen avoidance. Let's get started. The skin prick test, or known as the SPT, is the most commonly applied procedure for the investigation of possible sensitization to allergens. The skin prick test is easy to perform. It yields rapid and visible results, which are easily demonstrated to the patient. Because of their low cost and rapid results, SPTs are the preferred method to screen for allergic sensitization. Contraindications include the use of antihistamines and severe eczema. There is also minute but not absent risk of serious side effects. How about specific IgE measurements? This test determines the amount of IgE that reacts specifically with suspected or known allergens, for example, IgE to egg protein. Results are given in grades 0 to 6 and it is useful for food allergies, inhaled allergens, and wasp or bee venom. The main advantages of specific IgE measurements over SPT are that virtually all allergens can be tested and the results are not influenced by the use of antihistamines or eczema. In addition, there is no risk of side effects. The disadvantage of specific IgE measurements include the relatively long time taken to produce results, the burden of venipuncture, and relatively high costs. Allergen immunotherapy. Allergen immunotherapy, also known as desensitization or hyposensitization, is a medical treatment for environmental allergies. Immunotherapy involves exposing people to larger and larger amounts of allergens in an attempt to change the immune system's response. Allergen-specific immunotherapy aims to restore the tolerance to the allergen by reducing its tendency to induce IgE production. Successful immunotherapy has been associated with a shift from T helper cells immune response, which are associated with development of atopic conditions, to Th1 immune responses. It is also associated with the production of T regulatory cells that produce the anti-inflammatory cytokines, interleukins, amongst others such as transforming growth factor beta. Interleukin 10 has been shown to reduce the allergen-specific immunoglobulin antibodies, increase levels of immunoglobulin G, antibodies that play a role in secondary immune responses, and reduce the release of pro-inflammatory cytokines from mast cells, eosinophils, and T cells. Allergen-specific immunotherapy is indicated in patients with allergic rhinitis or conjunctivitis and/or allergic asthma who have evidence of specific IgE antibodies to clinically relevant allergens. Patients with allergic rhinitis or allergic asthma who may be good candidates for immunotherapy include those who have symptoms that are not well controlled by pharmacological therapy, require high doses of medication, multiple medications or both to maintain control of their disease, and experience adverse effects of medications or wish to avoid the long-term use of pharmacological therapy. There are many classes of drugs that are used in the treatment of allergy as they possess different anti-allergic properties. Many a times they are used in combinations to achieve goal of therapy. Antihistamines inhibit the effect of histamine at H1 receptor. This helps to reduce the symptoms that follow the release of histamine from the mast cells. Adrenaline is an agonist at both alpha and beta adrenoceptors. It works either by activating adrenoceptors, which then activate phospholipase C, causing vasoconstriction and a consequent increase in arterial blood pressure. It also acts by activating beta adrenoceptors, which then activates adenylyl cyclase, causing an increased heart rate and increased cardiac contractility. Glucocorticoids suppress the inflammatory response in bronchial mucosa and so diminish bronchial hyperresponsiveness. And mast cell stabilizers such as cromolyn glycate inhibits mast cell degranulation. The best defense against most allergies is to avoid the allergens that cause symptoms. Allergen avoidance is an imperative component in the management of allergies as a whole. Determine sensitization by using either skin prick test or in vitro test for specific IgE antibodies. Take a detailed environmental history focusing on the presence of pets, reservoirs where dust mites and mold allergens can reside, such as carpeting and upholstered furniture, any recent moisture-related problems, reported cleaning practices and frequency, and on whether the patient has observed evidence of cockroach and rodent infestation. If significant allergen exposure is suspected, it may help to have a qualified indoor environmental professional to assess the home for facilitative factors, which are things that promote allergen production, sources, and reservoirs for allergens. What are the limitations to this method of allergen avoidance? Patients may be sensitized to multiple environmental triggers with no readily available means for measurement to determine the exposure. Feasible interventions frequently are not able to reduce the exposure to triggers sufficiently to improve the outcomes, and patients are not willing to perform the necessary interventions. We have come to the end of this topic. Thank you.